The pancreas is an organ in your abdomen that lies behind the lower area of your stomach. The pancreas secretes hormones including insulin to help your body process sugar in the foods you eat and absorb nutrients. Various types of growths can occur in the pancreas, including cancerous and non-cancerous tumors. Unfortunately, pancreatic cancer is seldom detected in its early stages when it's most curable. This is because it usually doesn't cause symptoms until after it is spread to other organs. It is not clear exactly what causes pancreatic cancer. Medical professionals have identified factors that may increase the risk of this cancer, including smoking and certain inherited gene mutations. Here are the 5 biggest identifiable risk factors of pancreatic cancer that you can control. Smoking. Cigarette smoking doubles the risk of pancreatic cancer, and the more an individual smokes, the greater the risk. Scientists have estimated as many as 1 in 4 cases of pancreatic cancer are caused by smoking cigarettes. Smoking is also associated with an earlier age of diagnosis. It's important to note that the risk of pancreatic cancer drops back to normal after 10 years for people who quit smoking. Also important, it appears that filtered cigarettes do not decrease risk compared to non-filtered cigarettes. Simply put, smoking cigarettes is the leading preventable cause of pancreatic cancer. Obesity. People who are overweight or obese are more likely than other people to develop pancreatic cancer. Obesity has been found to increase the risk in approximately 12% of all pancreatic cancers. Some large population studies suggest that the risk due to obesity may be much higher. The risk is also higher the more weight you gain and the longer you remain overweight. Obesity is defined by having a body mass index of 30 or more. Research into obesity, inflammation, and pancreatic cancer has shown that obesity causes many genetic alterations in the pancreas, which may be one of the mechanisms that accelerate cancerous tumor development. Obesity can also cause inflammation in the pancreas, which is another risk factor for developing cancer of the pancreas. Alcohol. In the past, drinking alcohol was not considered an important risk factor for pancreatic cancer. However, recent studies of people who consume relatively large amounts of alcohol provide evidence that heavy and even moderate drinking can increase the risk for cancerous tumors. Results from studies consistently show that consumption of alcohol equivalent to 3 glasses of any alcoholic beverage per day is associated with a 20% increased risk of pancreatic cancer. Medical professionals consider this evidence to be strong. Diabetes. Pancreatic cancer is more common in people with diabetes. However, the reason for this is not known. Most of the risk is found in people with type 2 diabetes. This type of diabetes is increasing in children and adolescents as obesity in these age groups also rises. Type 2 diabetes in adults is often related to being overweight or obese. Individuals who have had diabetes for more than 5 years can be considered at a higher than average risk of developing pancreatic cancer. It's not yet clear if people with type 1 diabetes have a higher risk. Pancreatitis. Studies have shown that excessive alcohol consumption can lead to chronic pancreatitis and inflammation of the pancreas. Inflammatory cells secrete toxins and growth factors which cause genetic damage and uncontrolled growth of pancreatic cells, which leads to pancreatic cancer. However, it takes many years of chronic pancreatitis to increase the risk of pancreatic cancer. What's not clear is how much alcohol causes chronic pancreatitis. According to the American Cancer Society, women should drink no more than 1 alcoholic beverage per day, and men should drink no more than 2. What's certain is that pancreatic cancer is associated with large amounts of alcohol consumed over extended periods of time. Your diet may also play a role in increasing your risk of pancreatic cancer. Some research has indicated that eating an excessive amount of red and processed meat may increase your risk of developing pancreatic cancer. Western diets heavy in processed meat, saturated fats, and sugary drinks may increase the risk of pancreatic cancer, according to the American Cancer Society. However, not all studies link the two together, so more research is needed. Some early research hinted that coffee may affect risk for developing pancreatic cancer, but the largest study to date, published in 2015 in the British Journal of Cancer, shows no such pancreatic cancer risk. In addition, studies have suggested a link between soft drinks and pancreatic cancer, but more research is needed to understand and confirm this link. Most health experts recommend not drinking too many high-calorie soft drinks to promote a healthy lifestyle and avoid many diseases, including obesity and diabetes. Family history and non-modifiable risk factors. Most pancreatic cancer patients do not have a family history. However, scientists are still learning about the genes that are associated with inherited cancers. Researchers have identified some possible connections between family relationships and increased cancer risk. For example, individuals with 2 or more relatives who have had pancreatic cancer have an increased risk of developing pancreatic cancer. There are some inherited genes that are associated with an increased risk of multiple cancers. The American Cancer Society reports that up to 10% of pancreatic cancers are caused by inherited gene mutations that are passed from parent to child. Some risk factors for pancreatic cancer you simply can't change. These include age, gender, race, and even blood type. Almost all patients are older than 45 at the time of diagnosis, and the risk of developing pancreatic cancer increases with advancing age. Pancreatic cancer is most frequently diagnosed in people within the age ranges of 65 to 74, according to the American Cancer Society. Males are more likely to develop pancreatic cancer than females. This may be due to higher tobacco usage rates in men. In 2022, about 33,000 men and 29,000 women were diagnosed with pancreatic cancer. African Americans have higher rates of pancreatic cancer than Caucasians. While the reason is unknown, it may be related to higher rates of diabetes or smoking among these populations. A 2019 study in the Journal of the National Cancer Institute, scientists examined 2 previous studies that had collected blood from more than 100,000 U.S. health professionals and examined the association between certain blood types and pancreatic cancer development. Compared with blood group O, those with blood groups A, AB, and B were more likely to develop pancreatic cancer. Still, more research is needed to explore how exactly this happens. A 2018 study demonstrates patients with cystic fibrosis also have an increased risk of pancreatic cancer. There is no sure way to prevent pancreatic cancer. Some risk factors such as age, gender, race, and family history can't be controlled, but there are things you can do that might lower your risk. Smoking is the most important avoidable risk factor for pancreatic cancer. Maintaining a healthy weight might help you lower your risk as well. Getting regular physical activity can help you stay at a healthy weight and may also reduce your risk of pancreatic cancer. Excess processed and red meats and sugary drinks may also increase the risk. The American Cancer Society recommends following a healthy eating pattern that includes plenty of fruits, vegetables, and whole grains, and that limits or avoids highly processed and sugary foods and drinks. Heavy alcohol use has also been tied to pancreatic cancer. Heavy alcohol use can lead to conditions such as chronic pancreatitis, which is known to increase pancreatic cancer risk. It's best not to drink alcohol. If you drink, you should average no more than 1 drink per day for women and 2 drinks per day for men.